I'm Garvin Lynch and welcome to Lynch's Pharmacy Health video series. This video is on athlete's foot. The athlete's foot is a very common fungal infection of the skin on the feet. The skin between the little toes is often affected first. This is a good way to tell it apart from eczema or psoriasis, neither of which affect the skin between the toes. The skin usually develops a rash which becomes very itchy and scaly. The skin usually becomes cracked and very red and very sore. Sometimes the infection will spread to the sole of the foot and sometimes it will spread to the nail. If it does spread to the nail, it can be treated, but it can take a long time, often several weeks, to clear the infection from the nail. So it's really best to treat athlete's foot as soon as the symptoms occur. Now, because it's a fungal infection and the treatment mainly involves antifungal creams or other antifungal products, some of which are here. The Canesten 1% cream can be used 2 or 3 times a day, which is very effective for athlete's foot. Lamisil cream once or twice a day. Mysil do a couple of products. They do an ointment, a spray and a powder. The spray and the powder are quite useful on socks, so you can sprinkle the powder into the sock or spray the sock, and it protects the foot all throughout the day. Scholl do a similar range. They do a spray, an ointment and a powder as well, all used in the same way, and Dartarin does a cream and a powder. A couple of important points about all of these products is that you have to clean and dry the area before putting anything on it. The cream or powder should be applied to a couple of centimetres of healthy skin around the area that's affected. But the most important point about all of these is that although the rash may seem to clear up quite quickly, they all need to be used for at least 1, preferably 2 weeks after symptoms have cleared altogether, just to make sure the infection is completely gone. If none of these products are working, or the infection is in a couple of other places around the body, or is particularly bad, they may need an antifungal tablet by prescription from a GP, so we'll need referral. If the patient is a diabetic, they will also need referring to a GP. Diabetes can develop very serious foot problems, so a diabetic with athlete's foot or any other foot condition needs to go straight to their doctor. They'd be referred to a GP. So a steroid cream sometimes may be needed in athlete's foot along with an antifungal cream, but should never be used on its own or any fungal infection anywhere in the body. Steroid creams can actually make fungal infections worse, so never use on their own. And if the patient needs a steroid cream, it's probably best to refer just to be sure. In terms of a general advice for a patient with athlete's foot or a patient who wants to prevent athlete's foot, simple things like washing your feet and toes daily, making sure you dry the skin properly, especially get in between the toes, change the socks every day, ideally alternate your shoes every 2 or 3 days. Try to stay out of socks and runners as much as possible, as it's the worst possible combination for athlete's foot. Don't share towels in a dressing room. Ideally, wear flip-flops or some sort of footwear in the dressing rooms and around the pool. Most importantly, try to leave shoes and socks off completely, as much as possible. Often easier said than done, but it really is the best way of preventing athlete's foot. So the important things are to treat the symptoms as soon as they occur, to make sure you clean and dry the area before you put anything on it, and most importantly to use all these products for at least a week after the symptoms have cleared, just to make sure the fungal infection is completely gone. If you have any questions on athlete's foot, you can contact me through the live pharmacist. You can email me or call into the pharmacy in Broaddale in Maryborough Hill. Thank you for watching.